Welcome to another episode of MedMadness, where we delve deep into crucial medical topics. Today we are focusing on a significant and potentially life-threatening issue, acute abdominal pain in women of reproductive age. Understanding the evaluation and management of this condition is essential for healthcare providers, and we're here to guide you through it comprehensively. When a woman of reproductive age presents with acute abdominal pain, the first step is a rapid preliminary evaluation. This involves a focused history and physical examination, assessment of vital signs, and an overall evaluation of the clinical status. The aim is to quickly determine if the patient is hemodynamically stable or unstable. If there are signs of hemodynamic instability, such as hypertension or shock, immediate resuscitation measures are necessary. This includes consulting with a surgical team right away, performing a pregnancy test, and obtaining a complete blood count, type, and match. These steps are crucial to prepare for potential surgical intervention and to stabilize the patient. For hemodynamically stable patients, the next critical step is determining pregnancy status. Pregnancy testing, specifically measuring serum BHCG levels, is essential not only to guide the choice of imaging modality, but also to assess the risk for ectopic pregnancy, one of the most life-threatening causes of abdominal pain in women. An ectopic pregnancy can rupture, leading to severe intra-abdominal bleeding and peritoneal inflammation, which can present with low-grade fever. If the pregnancy test is positive, transvaginal ultrasonography becomes the next step. TVUS is invaluable for determining the location of the pregnancy and evaluating the adnexa, and it does so without exposing the patient to teratogenic ionizing radiation. Conversely, a negative pregnancy test makes ectopic pregnancy unlikely, prompting further evaluation for other potential diagnoses. Next, let's discuss the importance of alarm findings. At this juncture, it is essential to look for alarm findings such as peritoneal signs, tachycardia, or fever. The presence of these symptoms necessitates an urgent evaluation for life-threatening conditions. Gynecological emergencies like ovarian torsion or pelvic inflammatory disease with tuber-ovarian abscess must be considered, along with gastrointestinal issues like appendicitis or diverticulitis, urological emergencies such as complicated urinary tract infections or ureteral obstruction, and vascular catastrophes like a ruptured abdominal aortic aneurysm. In the absence of alarm findings, the focus shifts to more common conditions. These include gynecological issues like sexually transmitted infections, ovarian cysts and endometriosis, gastrointestinal problems such as gastroenteritis or irritable bowel syndrome, and urological conditions like uncomplicated UTIs and nephrolithiasis. Regardless of the suspected condition, determining pregnancy status remains a priority. This determination influences the selection of imaging studies and subsequent management plans. For instance, a CT scan might be warranted for suspected diverticulitis, whereas pelvic ultrasonography is preferred for assessing tubo-ovarian abscesses. In cases where the patient is hemodynamically unstable due to suspected intra-abdominal bleeding, diagnostic laparoscopy may be appropriate even before obtaining imaging studies. However, for stable patients, this immediate intervention is unnecessary. Instead, careful pain management and serial abdominal examinations are performed following diagnosis and treatment initiation, such as administering antibiotics for pelvic inflammatory disease. Let's bring this discussion to life with a real case study. Consider a 28-year-old woman who presented to the emergency department with severe lower abdominal pain, low-grade fever, and a heart rate of 110 beats per minute. Upon initial evaluation, her vital signs were stable, and there were no immediate signs of hemodynamic instability. A focused history revealed that her last menstrual period was 6 weeks ago, and she had experienced intermittent spotting since then. Given her reproductive age and symptoms, a pregnancy test was promptly performed, revealing an elevated serum BHCG level. Transvaginal ultrasonography was immediately conducted, which identified an ectopic pregnancy in the ampulla of the fallopian tube. Fortunately, the ectopic pregnancy had not yet ruptured. She was swiftly taken to the operating room for laparoscopic surgery, successfully resolving her condition before it could become life-threatening. This case underscores the critical importance of rapid and thorough evaluation of acute abdominal pain in women of reproductive age. By following a structured approach and prioritizing pregnancy status, healthcare providers can effectively manage this complex clinical scenario and ensure optimal patient outcomes. Thank you for joining us on this episode of MedMadness. Stay tuned for more insights and discussions on vital medical topics. Until next time, stay curious and stay informed. That wraps up our episode for today. We hope you found this discussion on acute abdominal pain in women of reproductive age both informative and practical. If you have any questions or topics you'd like us to cover, please reach out to us. Don't forget to subscribe and share MedMadness with your colleagues and friends. See you next time.